Hi everyone, this is Dr. Zach Borus from the Dickinson County Board of Health and Lakes Regional Healthcare here in Spirit Lake, Iowa. I'm coming to you on the 9th of April for another update on coronavirus locally, nationally, and here at the hospital. In terms of statistics, we still have one case confirmed here in Dickinson County. There might be unconfirmed cases, there are some presumptive positives, but again, we are still holding at one confirmed case. In the U.S., as you know, it's exploding. We are at 457,000 cases in the U.S. There have been over 16,000 deaths, and that's just going up significantly every day. Still mostly based in some large cities, but at the same time, there are rural pockets where it's exploded as well, places you would not expect. So worldwide, there's 1.6 million cases confirmed, 95,000 deaths. This is real, this is here, and we appreciate all that you're doing. Iowa has had 1,270 cases thus far, and there have been 29 deaths, unfortunately, here, and there are likely to be more. So we appreciate your interest in this and doing what you can to help flatten the curve. So first I wanted to just say thank you. Thank you for so many things that you're doing. Thank you for donations to the hospital, whether it's homemade masks, whether it's homemade gowns, whether it's buying pizza for the entire staff. We really appreciate you and thank you. It's keeping us going and it's keeping us safe. If you have things that you'd like to donate in terms of masks or other suggestions, you can contact Jennifer Gustafson at 336-8799. If you work at a business and have come across 1,095 respirators, you can contact the hospital and talk to our EMS chief, Chris Youngbluth, who is coordinating those donations. So thank you to the businesses and to the individuals who have donated thus far. We appreciate it greatly. Also, thank you all for staying home. You know, this is an interesting time. This is uncomfortable. This is we're getting really well acquainted with our families again, which is often wonderful, but we're also going stir crazy a little bit, so we get it. This is not easy for any of us. Our normal life is to be social, so we thank you for trying to avoid going out, trying to avoid seeing friends in person, trying to avoid playgrounds, which are now shut as of last Monday, and really, again, keep that up. I think this has been an interesting week. You know, it started out as talking about New York's numbers going wildly high, as they continue to be, but there's also been some hope that some of the models have been revised down in terms of estimated number of cases, estimated number of deaths. New York, at least in this peak, may be seeing its peak and starting to level off, but that still is, you know, nearly 1,000 deaths a day in New York right now. So we are hoping that being here in rural Iowa, our peak is going to be more gradual, and we're going to have much less devastation. But we can't control it necessarily, other than doing what we're doing in terms of staying home, staying out of groups, and washing hands, wearing a mask when you are out in public. That is now being recommended. So if you are somewhere where you can't be, where you can't help being 6 feet away from, less than 6 feet away from people, please wear a mask. So really, if you're going to Walmart because you need to get that week's worth of groceries, if you're going to Hy-Vee, even if you're going to pick up some food at one of the local restaurants, wear a mask, and they're going to do the same. So not comfortable, not something that we're used to, but again, it will help flatten the curve so that we have the resources available to take care of folks. I mentioned models before, so there are a few different models out there. So some models are saying that Iowa is going to meet its peak in the middle of April, and that's only 10 days away. I hope that that is the case and that it remains relatively small. Obviously, we've already had 29 deaths and over 1,200 cases confirmed. That alone is devastating, but it will likely get worse before it gets better. That said, Avera and South Dakota are predicting that their peak is going to be over a month later, in late May into early June, and need lots of ICU beds, lots of ventilators. That's always changing, these models, but we probably are more along the lines geographically and socially of the folks in Sioux Falls. So, we are trying to target our models here for when we're going to need it, but we are expecting our surge sometime in the next probably 4 to 8 weeks, but this is going to go on for a while. So be patient, work with us. If you had appointments that were scheduled just for a routine checkup, we'll probably do that by telemedicine. If you have something urgent, then contact the clinic and we'll get you seen, if it's respiratory and from the lungs up, we'll have you seen in a respiratory clinic, even if it turns out to be an ear infection. If there's high risk or high suspicion for COVID, we will get you seen in our specific high risk respiratory clinic. And if it's just, you got a urinary tract infection, or you got babies who need their immunizations and need their well checks, we will get you in a clean, safe environment. Really, the big thing that I wanted to push was don't let your guard down. Don't get complacent. The good news is really heartening, and hopefully there is more good news coming out in the coming weeks that, gosh, we're so prepared, and because of our preparation and because of everyone's social distancing efforts, we were able to keep the levels at bay, and then ample testing is going to be available so that we can try to get back to our regular lives with occasional blips and occasional self-quarantines, but that's probably going to be a couple months away. So don't let your guard down now. Please stay home. Please follow the social isolation guidelines. If you are needing help, reach out for it. You can go to iglcoronarelief.org and get help or volunteer to help. Reach out to your family, reach out to your pastors or other faith leaders, and touch base with your doctors too. So thank you for all you're doing. Thank you again for all of your generosity and for the community coming together. And together we can keep fighting this and keep everyone safe and healthy. So have a wonderful day. See you soon.